So this story has been circulating the last 24 hours, and I thought it was interesting, and it's not really being accurately represented by the media. Surprise, surprise. So basically, a woman in California went in and had a manicure and suffered a cut during the manicure, which did not heal. And after 3 months, she ended up seeing a dermatologist who biopsied the area, and she was found to have a squamous cell carcinoma, and it was resultant from a high-risk strain of HPV, human papillomavirus. Now, this is the same virus that can cause cervical cancer. It can cause head and neck cancers. So this is an interesting case, and the way the articles are being spun is that the cut she suffered in the manicure caused the cancer, and that's probably not how it works. So I'm not going to comment on her specifically, but for those of you out there, so HPV, there's many different strains. Some strains are high risk for cancer and some strains are not. And so when people become infected with different strains of HPV, some people can become infected and then clear the infection, and other people it can lay dormant in the cells. And so certain strains of HPV can end up causing changes that lead to different types of cancers, and we know this. It takes a really long time, though, from what our research shows. It's probably 10 to 20 years. So it's unlikely that this woman would suffer, or a person, let's not talk about her, would suffer a cut at a nail salon and then within 3 months develop a cancer. So in a scenario that could happen is you could be infected and have dormant in your tissues a higher risk strain of HPV, and then you potentially could have an early cancer. The area is more tender and friable, and then suffer an injury, and then it kind of would lead to an eventual diagnosis. So I'm not going to comment on what she had because they're not really saying what strain it was or the situation, but I do think it's a little unfair that she's all over the place blaming the nail tech when it was almost certainly not the nail tech's fault she developed a cancer. Now, I will note that the HPV vaccines do cover a variety of high-risk strains, so I do want to stress the importance of the HPV vaccine. I know that it has been controversy in the past, but it is probably the single greatest women's health breakthrough of my medical generation, and for a variety of reasons, I feel strongly that children should have this series when it is appropriate. So anyway, I thought it was an interesting story. If you're an anti-vaxxer and have a comment, don't try me because I will block you and delete your comments. And anyway, go do your nails. You're not going to get cancer from having your nails done, almost certainly. And if you're not vaccinated and of the age where it is appropriate, go ahead and get it, please.